So a study came out here a couple weeks ago, and it says that we have now reached about 1 billion overweight or obese people in the world. And this is concerning because we've gotten here much faster than what the experts predicted that we would get here. But there are other implications for this. Our healthcare costs are something that is a massive concern for all of us, right? Something that we really need to pay attention to. And if we don't pay attention to that, then it's going to lead us to an economic disaster that is far beyond what we've experienced anywhere in the past. It's something that we really have to start paying attention to. The Journal of Managed Care and Specialty Pharmacy says that it takes double the amount of money to take care of somebody who is obese versus somebody who is normal weight. That is a massive, massive number, double the amount of money. The thing that may make this an even bigger disaster is that the rate is rising faster in children and adolescents than it is in adults. So they're going to have to use that over an extended period of time. Anytime that we have to take care of a disease, disorder, or dysfunction over a longer period of time, we end up having more visits, we end up having more care, we end up having more of everything, and that spirals those costs faster and faster in the wrong direction. So we really have to be careful for this. Now, this is more, I took more out of this than what I think most people would look into. So when I look into this, everybody puts the risk of heart disease and the risk of cancer and the risk of stroke and the risk of all these other things in with this. And that's something else that rises the cost of this. The more likely you are to have those other chronic diseases, the faster this number rises. The cost of cancer for the average lifetime cost for one person, cancer, mid six figures. Average cost of heart disease, anywhere from 1 million to 4.8 million, depending on the research you read. It's just astronomical. Diabetes is another one that's very common in this. And diabetes, 1 in 4 of our healthcare dollars already go to diabetes care. 25%. It's crazy how fast some of these things add up. But the leap that I see in a lot of this that I don't think a lot of people are aware of is last year a study came out and it said that obesity is a neurodevelopmental disorder. So it changes the brain in a way that signals the rest of the body to actually perpetuate that. So what are other neurodevelopmental disorders? ADHD, dyslexia, autism, autoimmunity, insomnia can be. Different things like that are all considered neurodevelopmental disorders. That's a big deal, right? We start getting into that pattern. We start seeing more of the likelihood of seeing things like depression or anxiety or Alzheimer's disease or autoimmunity or all of these other chronic diseases that are also very, very expensive. So that cost starts to really spiral faster and faster and faster. Now, how do we get out of this, right? This is something that we've looked at for a long period of time and we really haven't made much progress. A lot of people look at this and say, all right, it's a genetic disorder. If your parents had it, you're going to have it. If your grandparents had it, then your parents were going to have it, you're going to have it, your kids are going to have it, and it just goes throughout. But that's not the reason that we're in these patterns of neurodevelopmental disorders. These neurodevelopmental disorders are epigenetic in nature. And the epigenetics are just like a light switch. It's either on or off. That gene gets expressed or it doesn't get expressed. So you may have that gene passed down. Genetics may be related to this, but the choices that we make have a massive impact on this stuff. And unfortunately, we pay for some of the choices that were made in the generations before us. Up to 13 generations of choices come to what we experience right now, right? Depending on the study that you read. Some of them say 7, some of them say 11, some of them say 13, but up to 13 generations are affected. The choices that we are making today are going to affect the next 13 generations after us. Very, very important that we get this right. If humans are going to stay, an actual thing, if we're not going to go extinct, then we've got to start making some choices for the long term. And epigenetics are really the link to this. We've got to make those choices that are going to change the epigenetic expression so we can actually see a healthier expression of our life. And that's something that is, it's not as difficult to do as a lot of people think, right? They call these lifestyle diseases because the things that we decide to do make a determination on what gets expressed. And that's a powerful thing. But where do a lot of people go? A lot of people look at just changing their diet. unfortunately, they change their diet in a way that is not sustainable long term, or they change their diet in a way that is recommended by the government, right? We saw a lot of this when they recommended taking out fats out of your diet. That's kind of when some of this started. But that there are a lot of things that were introduced at that time too. We got exposed to a lot more plastics. We got exposed to a lot more chemicals. We got exposed to a ton of things throughout this. The nutrition of our food has gone down in that time. There are a lot of different things that contribute to this, and there's a ton of people that I have seen that are like, it's this one thing. You see this trajectory and it goes right along with, but there's a ton of things that you could do that. Correlation is not causation, right? But it has to be more than just doing a detox. It has to be more than just changing your diet for the short term. It has to be more than a Band-Aid fix. We have to put a long-term fix on this. And that's really, it's really what I want for you. I want to help you make that change where you can take your current situation and make an alteration that you're going to be able to do for a lifetime. Enjoy a lifetime of health versus suffering with some of these things that bring on those added costs and those decreased years of health span. All right? A lot of people are focused on longevity. A lot of people are talking about it. But there's not many people that longevity is the right answer for, right? We're not healthy as a society in general. We need to get healthy. If we're going to focus on that longevity, we want to have increase in health span. We don't want to just have increased years that we're miserable. We want to have increased years that we're doing the things that we want to do, that we're having the impact that we want to have, that we're sharing those unique gifts that we have. And this is something we have to pay attention to. So, scary study, 1 billion people are now obese, and we've really got to start paying attention to that. So if you have any questions, I'm happy to answer however I can. Obviously, I really appreciate you spending the time and the attention on this. I know that that's your greatest asset, and I will catch you on your next video.